Here are some important points regarding Down syndrome which are again and again asked in competitive exams. So some associations that are related with Down syndrome are duodenal atresia, then we can see atrioventricular septal defect, which is a congenital cardiac defect, and Hirschsprung disease, which is also associated with Down syndrome. We can see Alzheimer's disease, which is seen early in Down syndrome patients. The reason for that is basically, we all know that Down syndrome is basically trisomy 21. So chromosome number 21, it actually codes for the amyloid precursors. So these amyloid precursor proteins are basically responsible for this Alzheimer's. Also, we can see AML under 5 years of age and ALL more than 5 years of age. There is associated risk with Down syndrome. There is another associated risk of umbilical hernia in Down syndrome that is seen. So here we can see a radiological image of duodenal atresia where we can notice two dilated loops of GIT. So this is known as the this is known as the double bubble sign of duodenal atresia, which is associated with Down syndrome. Here the first bubble is the stomach and the second one is the duodenum. This is the dilated bile loop which is seen in Hirschsprung disease. You can see this bile loop is dilated, and this is seen in Hirschsprung disease. So what is the basic pathology? As we all know, Down syndrome is basically trisomy 21. So the mechanism, in 95% of cases, it is due to meiotic non-disjunction. We should remember this is a very important point. And it is mostly seen in meiosis 1. That is another important point. And you should remember this totally depends on the age of the mother. The more the age, there is more chance of this happening. So other mechanisms like 4% causes are due to Robertsonian translocation. Mostly it is due to chromosome 14 to 21 translocation. And the last 1% is due to post-fertilization mitotic error. So this is a karyotyping of Down syndrome. You can see the karyotype in chromosome number 21. They are marked. There are 3 chromosomes. So trisomy 21. That is basically Down syndrome pathology. So what are the radiological signs or sonographic signs that we can see in Down syndrome babies? So basically in the first trimester sonography, we can see the nuchal translucency that is more than 3 centimeters, and we can also see hypoplastic nasal bone, and the femur and humerus length is almost reduced in first trimester ultrasonography. So this is a normal neural tube. So this is the normal nuchal translucency that you can see here, this one. And here this is a Down syndrome baby. You can see the nuchal translucency is very much increased here. You can see. The next image, you can see some hypoplasia in the nasal bone. You can see here the nasal bone is hypoplastic. That is also seen in Down syndrome babies. So what are the markers for Down syndrome? The markers that you should remember is beta ECG. So the ECG level that is increased. The second one is inhibin, that is mostly increased in the second trimester. So inhibin and ECG, these two are basically increased, and also neutrophil alkaline phosphatase, if you look for, that is also increased. Apart from that, other markers like estriol and alpha fetoprotein, these things decreases. Another protein that you should look for, that is PAPPA. So this is also decreased in case of Down syndrome. So how do you diagnose? Basically the methods which are preferred is from 10th to 12th week, the method is chorionic villus sampling. That is the preferred method of diagnosis, and from 14 to 18 weeks the amniocentesis is the preferred method of diagnosis. So if you look at it clinically, what are the clinical signs that you can see is, in the baby you can see this is the palm of the baby, and you can see this single line that is known as the simian crease, that is seen in the baby's hands. The next thing clinically you can see is this gap between this first and second toe in the leg, that is known as the sandal gap. The sandal gap, that is also seen in other cases also. So some features of Down syndrome, basically as a whole, we can remember the basic faces of Down syndrome faces that you can see here. That is the flattened nose and face. There is a upward slanting of eyes. The eyes will be upward slanted, and the tongue, you can see the protruded small tongue. You can see the simian crease on the palms of the babies. You can look at the small hands, small humerus, small legs due to small femur bone, and there is a sandal gap, that is the widely separated first and second toes, and also under the sole you can see more skin folds, like skin creases. So these are the basic features or characteristics of Down syndrome. So thank you guys for watching. Subscribe for more, and see you next time.